Last time, we watched a city sleep while 3 kilometers away, reactor number 4 destroyed itself. We watched a government stay silent for 36 hours while radiation spread through the streets, through the air, through the bodies of people who had no idea what was happening to them. But here is the thing about Chernobyl that most people still don't fully understand. The explosion was not the real disaster. The real disaster was what came after. Because once the reactor was destroyed, the Soviet government made a decision not to save lives, not to warn people, not to tell the truth. They decided to bury it. This is declassified. To understand the cover-up, you first need to understand one number: 35 Roentgens. For the general public, a limit that existed for a reason, because beyond that limit, the human body begins to suffer measurable, serious, long-term damage. Within weeks of the explosion, radiation monitors across Ukraine and Belarus were recording levels far above that limit. In some villages, the readings were 10 times higher. In some zones, 35 times higher. Under normal circumstances, this would have triggered mass evacuations. It would have triggered medical screenings. It would have triggered public health warnings. Instead, the Soviet Ministry of Health simply raised the limit. The declassified documents confirm this. An internal government order, issued in May 1986, quietly increased the acceptable radiation dose for Soviet citizens from 35 Roentgens to 35 times that amount. In one stroke, with a single classified document, over 10,000 people who had been hospitalized for radiation exposure were reclassified as healthy, not because their health had improved, not because new science had emerged, but because the government had simply decided that the old definition of sick was politically inconvenient. But rewriting the numbers on paper was only half of the cover-up, because there were people who knew the real numbers: doctors, scientists, medical professionals who were seeing the truth every single day in their own hospitals. And the government had a plan for them too. There were doctors who knew, physicians working in Ukraine and Belarus who were seeing patients every day, patients with symptoms that were unmistakable: thyroid problems, immune system failure, cancers appearing in populations that had no prior history of them. These doctors wanted to record what they were seeing. They wanted to put it in their patients' files. They wanted to write the diagnosis clearly so that treatment could follow. They were forbidden. A classified directive issued by the Soviet Ministry of Health and the Ministry of Defense. Physicians must not enter a diagnosis of acute radiation syndrome in the files of liquidators. A substitute term must be used. So doctors wrote heart failure, respiratory complications. They wrote burns from unspecified causes. Any doctor who tried to file an honest report faced serious consequences. Some were visited by the KGB. Declassified records confirm that scientists who attempted to publish independent measurements of radioactivity, measurements that contradicted the government's official figures, were detained. Not metaphorically, physically detained by the KGB for publishing the truth. And in the villages, local officials in the Narodichi district of Ukraine were instructed to destroy primary medical documents. The original records showing actual radiation doses received by residents. Medical staff were ordered to register understated dose values, to literally write down numbers that they knew were false, because the real numbers were classified. There is one document that when I first read it, I had to stop. It is a classified recommendation issued by Soviet authorities regarding food contaminated by Chernobyl radiation. Disperse the meat contaminated with radioactive material around the country as much as possible and use it for the production of sausage products, canned goods, and manufactured meat products at a ratio of 1:10 with normal meat. Read that again. They were not destroying the contaminated food. They were not quarantining it. They were mixing it into the national food supply, diluting it, spreading it, so the numbers would stay below the threshold. Soviet citizens across Ukraine, Belarus, and Russia were eating that food, not knowing, not warned, not given a choice. Children were drinking milk from cows that had grazed on contaminated grass, milk that was carrying radioactive iodine 131 directly into their thyroid glands. By 2005, 6,000 cases of childhood thyroid cancer had been recorded in the affected populations, a disease that, in that region, had been almost non-existent before 1986. But of everything that happened in this cover-up, nothing is harder to hear than what they did to the people they sent in to fix it. The people who were given a shovel and 90 seconds and told to get on with it. Now, let's talk about the liquidators. 600,000 people. Some records suggest as many as 800,000. Soldiers, miners, engineers, firefighters, ordinary workers, drafted, ordered, or volunteered into the exclusion zone to clean up what the Soviet nuclear program had created. The most dangerous assignment was the roof of reactor number 3, directly adjacent to the destroyed reactor, covered in highly radioactive graphite fragments that had been blasted out of reactor number 4 during the explosion. That graphite had to be cleared by hand. Robots were sent in first. They broke down. The radiation levels were so extreme, they destroyed the machine's electronics. So they sent in men. Each worker on that roof was permitted a maximum of 40 to 90 seconds. Run up, shovel graphite, run back. 40 seconds. Done. Next man. 3,828 men cleared that roof. Each one received more than 5 times the annual safety limit in under 2 minutes. And in October 1986, a group of liquidators wrote a letter from a sanatorium in the Kharkov region of Ukraine, addressed directly to the Central Committee of the Communist Party. They wrote about inadequate medical care, about doctors who had no expertise in radiation, about checkups that were simply not being provided. They wrote about promises broken, housing they were guaranteed and never received. These were the men who went in when the robots broke down, the men who used their bodies to contain a disaster that their own government had created, and when they came home, they were on their own. So after all of this, after the altered records, the contaminated food, the silenced doctors, the broken liquidators, one question remains. What is the real number? How many people actually died? And why is that question still unanswered today? So what is the real death toll? The Soviet government's official figure was 31 deaths. From the worst nuclear disaster in human history, the United Nations, after 2 decades of research, concluded at least 4,000 deaths from long-term radiation effects. Greenpeace estimated 200,000 deaths from 1990 to 2004 alone. The Ukrainian Health Ministry, as recently as 2016, stated that 20,000 liquidators die every year from Chernobyl-related illnesses. Every year. Not in 1986. Now. And the reason we cannot know the true number is not because the data doesn't exist. It's because the data was destroyed. Medical records altered. Autopsies not performed. Causes of death changed. Doses falsified. Documents classified. Scientists silenced. And a radiation limit that was simply rewritten to make the numbers disappear. The journalist Alla Yaroshinskaya, who spent years uncovering these documents, put it in a single line. The main deadly isotope leaking from the Chernobyl reactor was not cesium-137. It was deception-86. The cover-up did not end when the Soviet Union collapsed in 1991. Thousands of liquidators are still fighting for medical recognition, still fighting for compensation, still fighting to have their illnesses officially connected to what they did at Chernobyl. Because if those connections are officially confirmed, then the governments that sent them in would have to answer for it. In the next episode, we go inside the sarcophagus, the concrete structure built over the destroyed reactor in just 206 days by workers who were told it would last forever. It was never meant to last forever. The engineers who built it knew that. They wrote it in their internal reports. And those reports were classified. This is Declassified.